husband is a doctor. That may make me biased. It does make me knowledgeable. I repeatedly hear from my husband's patients that they trust him and appreciate the excellent care and advice that he provides. Unfortunately, others don't consider my husband, a physician, to be the most qualified when it comes to advising patients and their families in making healthcare decisions. Rather, President Obama and some Democrats in Congress think Washington should make those decisions. In other words, that our government should tell doctors how to practice medicine and dictate to patients the kind of care they receive, by whom, and when. For years, doctors have had insurance companies impose medically necessary rules on the practice of medicine. Worse yet, in the search of the almighty dollar, plaintiffs' lawyers have sued again and again in an effort to impose their medical expertise on doctors, causing remarkable increases in the current and unnecessary cost expenditures related to defensive medicine. That's why I was astonished to learn that in over 1,000 pages of doublespeak, Congress's healthcare reform bill makes no mention whatsoever of medical liability reform, something that real healthcare experts agree is mandatory in any discussion of constraining costs and improving the sustainability of quality healthcare delivery. Any attempt to address healthcare reform without addressing medical liability reform is like putting a Band-Aid over an open gash. If we don't sew up the wound, the bleeding will continue, and the patient, or in this case the American public, will bleed to death waiting for appropriate care. When it comes to health care, it is not enough just to treat the symptom. You have to treat the cause. Likewise, when it comes to effective health care reform, we have to address medical liability reform. That includes the creation of health courts, administrative compensation systems, reasonable caps on non-economic damages, limits on contingency fees, and safe harbors for physicians who follow best practice guidelines, which should be set by other physicians and not by government pencil pushers. I am confident that if we adopt a system that reduces the necessity to engage in defensive medicine to protect from frivolous and abusive lawsuits, our nation's healthcare costs will significantly decrease. In fact, according to the Pacific Research Institute, scholarly studies show that $124 billion in healthcare expenditures were initially and primarily driven by medical liability concerns. Some say that's more than enough needed to provide insurance to the uninsured poor. Simply because the trial bar significantly contributes to the campaigns of many congressional members is not reason enough for them to get a pass on the healthcare reform pill many are trying to jam down our throats. As a physician's wife and mother of 3 children, I oppose a government takeover of our healthcare system. I further oppose any healthcare reform that does not include medical liability reform. If, however, members of Congress and their plaintiff lawyer friends are successful in passing their government-run plan while failing to address much-needed medical liability reform, I will sign up my family the day after they enroll their families. In other words, when hell freezes over. That's this week's Freedom Minute.